Hi guys, I'm Shivani Trehan and welcome to my channel Social Cravings. Women often associate ultrasounds with only pregnancy. However, that is not the case. An ultrasound is a very important part of a woman's overall health. I wish I had got my ultrasound done a lot sooner because then I would have known that I was developing endometriosis, ovarian cysts and fibroids. Also, perhaps I could have taken action on it a lot sooner in terms of age and in terms of development of these conditions. Today I'm going to make you meet my radiologist who has been an integral part of my endometriosis journey. She is Dr. Manju Handa Virmani, who has spent over 40 years as a radiologist in Delhi. She is also a co-author of the book Step by Step Breast Ultrasound. In this video, she will explain the importance of ultrasounds in a woman's health, the ideal age for an ultrasound, and also emphasize on the different kinds of ultrasounds for single and married women. We will also share some images of women with endometriosis. We will be sharing their ultrasound images. However, before we meet her, just a little background on how I connected with her. I was sick for many years. I had low-grade fever for many months. However, none of my doctors prescribed me an ultrasound and therefore I never got to know that I had endometriosis for so many years. In fact, I've spoken about my endometriosis journey in another video which I will link down in the description box below. So when I was detected with endometriosis, I went to an all-women's hospital, a very reputed one in Delhi, and they gave me a very small report. Then during my endometriosis journey, I came across a gynecologist who told me to go to Dr. Virmani for a detailed report. And oh my god, detailed it was. I had a 3D transvaginal ultrasound done. I had color images of my pelvis, of my abdominal. I had measurements of my fibroids, of my cysts, of my ovaries, of my endometriotum lining and more. So she has taken all my ultrasounds ever since 2017, like ever since I was diagnosed with endometriosis, and she is the first witness to my progress with endometriosis. And even today, if any doctor or any gynecologist sees my report, they say that it's really detailed, it's very good, it's very impressive. And they always ask me for her details. So let's go and meet her now. Hi doctor, I just introduced you. Is there anything that you would like to add?
I would actually like to thank you for the kind introduction which you gave. It was really nice. Thank you for that.
Why don't we start by talking about what is an ultrasound and the importance of it in women's health?
You know, ultrasound uses high frequency sound waves to create images of all the internal organs, and you can see that I'm standing behind an ultrasound unit and we use these are called the transducers. There are different kind of transducers which have different frequency, and we use that for different settings. So this is one of the main ones which we like to use, and we can press over the woman's abdomen or pelvis, and that gives us images through the abdomen of uterus and ovaries, and it's called a transabdominal scan. Then there's another kind of scan where we use what we call an endovaginal probe, and this is what it looks like. And this we generally use it in India in women who are married or who are sexually active. And this probe is very simple, it's pretty painless, it's completely harmless, and we get excellent resolution because it gives us, we are closer to the uterus and ovary, so our resolution is far superior. There's another kind of ultrasound which we can do in women who are not married. That is called a transrectal ultrasound. What we do is we insert this probe in through the rectum. Again, I would like to add, this is a completely painless procedure. It's only uncomfortable when it goes in, when we are trying to introduce it into the rectum. Otherwise, it's completely painless. And the discomfort, it's the only thing which one feels is discomfort. The resolution which we get on both endorectal ultrasound or an endovaginal ultrasound is pretty much similar. And I would just like to add, I think I didn't do that, endovaginal ultrasound is completely painless. There is no pain involved in that at all.
So doctor, what do you think would be the ideal age to get the first ultrasound done? Usually, ultrasounds are done when the gynecologist prescribes one. So, the question could also be, when is a good time or an ideal age to go for a first visit to the gynecologist?
Actually, if you ask me this question, there is no ideal age for ultrasound. We in India, we as women or girls, we are brought up with a very conservative environment where we feel that if there's anything wrong with us, we cannot disclose it. So the social impact is a lot. So our women or girls go through the pain and excessive bleeding without reporting. The other social stigma which I feel is once they are also worried that once they get married and the in-laws or the social impact of the in-laws accepting that this girl had problems earlier. So most of the time in India I have found that they only come for checkups after they're married. The other problem which I feel where the social stigma is concerned is that once they're married, some of the guys refuse to accept this, and they said that there was a problem which was happening earlier. So so they don't like to come. No, in India it's very, very, very reluctant women who will come for an ultrasound when there is no clinical symptoms.
What if a 16-year-old girl would come to you and complain of painful periods? What would you recommend to her?
Yes, I would recommend an ultrasound immediately. Any irregularity in the period, any painful period, yes, she needs an ultrasound. We will do an ultrasound through her abdomen. We have different frequency probes and we will see what we can do. And yes, if there is a lesion, I do recommend these girls, and I find these girls very cooperative. When I ask them, I explain them that I'm going to do an ultrasound from the rectum, they are okay to accept. Especially also the girls who are really suffering with pain. They have no hesitation at all, and they said, we want to be treated, please go ahead and do what you have to do.
So, doctor, you know that I've been coming to you for endometriosis. Can you briefly explain what is endometriosis?
Endometriosis is a very common gynecological condition which affects women during the childbearing age group. Now, what happens is that the name endometriosis was from this word endometrium, which is the inner lining of the uterus. Now, this lining during menstrual cycle gets developed. When the menses come, it sheds off. This lining starts growing outside the uterus. When it starts growing outside the uterus, it may be the commonest areas where it grows as ovaries and fallopian tubes. Now, wherever it forms, then during menstrual cycle, because of the hormonal changes, that lining, that area gets affected similarly as to what the endometrium in the uterus does to the hormones. So what have they, when the menstrual cycle takes place, there's bleeding inside, that bleed becomes like a blister or like a cyst, and that gives inflammation and scarring to the surrounding tissue, and that is when the patients become symptomatic.
Is that what you call a chocolate cyst?
That's right, that's called a chocolate cyst. And those are the different kind of cysts which I would like to show you on the ultrasound, how we can help you, how as a radiologist or an ultrasonologist we can help you to pick it up so that your doctors or your gynecologists can help you with the management.
So, doctor, how does an ultrasound help to detect endometriosis, and also does it help to detect different kinds of endometriosis like a bowel endometriosis or like the one in the abdomen?
First thing I would like to say that ultrasound is the primary imaging modality for any woman. Before doing any other study, it gives us excellent resolution, and most of the time we do not need MR. MR is a problem solving modality, so the ultrasound is the imaging modality of choice. At any time we can do it, whether the patient is bleeding, not bleeding, or pain or whatever. It's a very simple procedure. And also I would like to show on this how we can pick up different lesions. So like I said, ultrasound is the primary imaging modality of choice, and before moving on, what does endometriosis look like on an ultrasound, we need to see what is a normal looking ovary. So these are the two images of the same ovary, one in long axis, one in transverse view, and it shows a normal looking texture with these multiple small follicles and a normal ovarian stroma. This is a pretty classic normal ovary. Now we'll go to what does an endometriotic cyst look like. This is what we call we can see that there is a cyst in the one of the ovaries. It's a right ovary, and this, which is very well circumscribed cyst in both long axis and the transverse view, shows low level diffuse homogeneous low level echoes, and is classically called as a ground glass appearance. And this is one of the classic signs of endometriosis, and ultrasound is very diagnostic for endometriosis. What we are seeing here is also a normal ovarian tissue which is in the periphery.
So doctor, you're saying that this whole round is the cyst?
This is the cyst, and that's the normal ovarian tissue. Then what else we can do on the ultrasound is, so we do a color flow, and most of the time we will see that there is no vessels. These vessels which you're seeing, these color vessels, these are vessels, but we generally endometriotic cysts are always avascular. We can also do a 3D on these cysts, and we can see that we have this multiplanar format where we have the cyst in all three angles, and so we can see that these are well circumscribed, they are thin walled, there is there is the parenchyma of normal ovarian tissue which is compressed on one side, and 3D is helpful, but I think classically we can diagnose endometriosis on a 2D ultrasound also.
Okay. Can you tell us the approximate size of this cyst?
Sure. Yeah, we can just measure it. And so it's roughly about 3 centimeter or so, 3 by 2.5 centimeter on an average. Showed you on the monitor what the endometriotic cyst looks like, and these are all different kinds of endometriotic cysts. And most of them you will see that there's a single locular, it's a unilocular type of cyst. But they can be multiple locular also, because when there are multiple cysts, they get closely packed together and they give an appearance of a multilocular. Then sometimes there are these echoes as a differential fluid level, which is what we can see here, because there's a debris and that the lighter fluid just rises up and the denser fluid goes down. Then we can also see sometimes these echogenic areas, which you can see here. These are just the nodules within the in the endometriotic cyst, which is just retracted blood clots. And the one more thing which I would like to add is, when we use the real-time ultrasound, when we try to move these are immobile. These are fixed to the surrounding tissue because of scarring, and that's pretty much another one of a very good signs to say that this is endometriosis. When we come into severe endometriosis, now here we can see both these images show classic endometriotic cysts which are going down posterior to the uterus. They are adherent to each other, and they are also adherent to the uterus. And they have this has classic ground glass appearance. Here we can see lower level echoes plus fluid debris level. So these both cases of endometriosis, and this is severe, and this is one of the signs which is called as kissing ovarian sign, because we cannot separate both the ovaries from each other, and in both these we do not see any normal ovarian tissue. So this is a severe form of endometriosis.
So this would be like stage 4.
Stage 4 would be when this endometriosis starts in going into the bowel loops, and you start getting the similar sort of patches on the bowel or posterior to the uterus, which is called the pouch of Douglas. So those are the areas when they start getting affected. That's when we have a stage 4. So like I've been saying all the time, ultrasound is the primary imaging modality. Where does MR come? MR is a problem solving modality. Now, if there's a patient who's got severe symptoms and the surgeon wants to operate, they need to know if it's stage 4. That's where MR may helpful, that how much extension of the endometriotic nodule is there into the bowel or into the surrounding tissues.
Doctor, sometimes we read and hear that a laparoscopy is the only way to detect endometriosis. Is that true?
No, I think radiological modalities like ultrasound is excellent to pick up. It's classically, we can classically diagnose endometriosis on an ultrasound. Laparoscopy is for management. Also, ultrasound has an advantage that we can follow these patients up after what they are being treated. We can follow these patients on an ultrasound. Like I said, it's a harmless modality, so we can follow them and see are they responding to the therapy or not.
So, doctor, what happens if these ultrasounds are not done timely?
Well, the severity of the disease will go up, because unless we pick it up on the ultrasound, they cannot be clinically managed, and it will start advancing into the surrounding tissues and get into what we call deep pelvic endometriosis.
Thank you, doctor. Thank you so much. It was lovely talking to you, and this entire discussion and session has been really informative. Thank you so much for your time. I hope this video was helpful. One of the most significant things that I would like to take away from this discussion is that we should look at painful periods in a more serious and investigative way, and should look at it from a more in-depth angle and just not shrug it off as something normal. Also, if you know that you have a cyst or you have endometriosis, don't leave it ignored. Take action so that it doesn't turn into something more critical or severe. I would also like to add here that even though a woman clinically may not have any symptoms of any of these conditions, however, it's super important to get regular checkups done. And this is irrespective of the fact whether you're married or not. And an ultrasound is the most basic and preliminary checkup for any woman. And I hope we can pass on this awareness to our future generations and change the social burdens, the stigmas, the fears behind all these conditions. And that's it for today, guys. Feel free to like and share this video and subscribe to my channel. Stay healthy and happy. Lots of love.